I'm Dr. Patricia Janssen. I'm a faculty member in the UBC School of Population and Public Health at the Faculty of Medicine, and I'm a senior scholar at the BC Research Institute at Children's Hospital. I am the co-founder of a program called Smart Parent, which offers education through text messaging to pregnant people and people parenting for the first year of the baby's life.
My name is Gabriele Dumpys Woolever. I'm the research manager at the Center for Migration Studies here at UBC. I'm also the producer and host of our podcast, the Global Migration Podcast. And in that podcast, we take research projects and instead of having sort of an academic talking heads back and forth explanation of research, we take a storytelling approach so that the story is really grounded in the lived experience of the people that are involved in the research and not just coming from the perspective of academic language or just verbal processing, but really getting into the experience and the feelings of the people that are involved.
Hi, I'm Dr. Biz Nijdam, and I'm faculty in the Department of Central, Eastern, and Northern European Studies, and I'm the director of the UBC Comic Studies Cluster. And this organization on campus, or this sort of Center for Comic Studies on campus, has a number of components to it. But one of the most important parts of the work that I'm doing right now is partnering with faculty members at UBC, nonprofits, and First Nations to tell stories through comics and graphic novels. Storytelling in partnered research for my work in comic studies is also partnered storytelling in research. The partnership comes on many levels. We partner with organizations to tell different kinds of stories about lived experience or scholarly outputs. So in that sense, we're partnering with community partners or faculty members. But then the comic storytelling itself is a form of partnership. And it's a partnership between the artist and the individual that has the story to tell. And so there's so many layers to the way that partnership works in comics. And I think that's one of the strengths of the medium, because it allows multiple people to contribute to a story in a way that you might also see in larger forms of cultural production. But we don't need the big budget of a documentary film, and we don't need the big budget of a cinematic film. And it's not the isolated work of producing a novel. Partnership is probably at the very foundation of the work that I do. And then these stories that emerge, they speak to different audiences and they use different tools to tell those stories. They're highly individual, not only in the artistic format, which the subjective representation of whatever visual style is engaged, but also in terms of the story itself. It's relating some sort of lived experience or connects scholarship with individuals through the storytelling format. So turning to partnered storytelling or storytelling in partnered research is really very authentic to working in comics. And so I never really thought about that move until I was approached to talk about it in this particular forum, because it's just already embedded in the work that we do in comics.
For me, in working with the podcast, working in partnered research with storytelling, it really embodies a practice of ethics in research that's really important to me, regardless of it being in a storytelling medium. But storytelling as an approach both demands and facilitates partnership and ethical partnership in a way that perhaps other kinds of more traditional research can overlook. One of the things that I value about podcasting is that there's such an intimacy to the human voice, and that's true of the experience of the people talking, of like when I get to talk with the people that are involved in the interview or the researchers themselves, and then also what the people, the audience, what the people listening to it in the end also experience. We've seen culturally the growth of audio storytelling and podcasts, and they've been commercialized to different degrees for sure, but there is still something profoundly valuable about this intimacy of the voice and the intimacy of listening and the practice of it, both physically and what it does to our bodies to hear, and also socially, like what kinds of things we experience differently through what I call sonic knowing. If you read the word like the baby is crying, or you see a picture of a baby crying, compared to if you hear it, you're in a room and you hear a child's cry, or think of a thunderstorm or rain. it's really different. And that's part of the impact of storytelling through sound. The partnership part of it is very important in terms of research, because we worked directly with research partners that were engaged in existing research projects. We were already working with them to access participants, as it were, so there were existing relationships there that made sure that we were dealing ethically and reciprocally with them. And I'll say more about this in a minute, but we worked to involve the participants who were in the stories every step of the way, including final listens and final approval. They were our first and last audience in terms of producing these stories. And so that's one way that a true partnership with us, avoiding the reproduction of too many hierarchies, can be possible in sound stories.
We chose texting because a text just arrives in your phone. You don't have to look for it. You don't have to search through web pages. You don't need to go through layers of an app. You just look at your phone and there it is. And either you need to know that or you don't. You don't need to know what you don't know. You just accept the text as it comes. And we deliver 3 text messages every week, which are geared to the due date of the pregnancy or the baby's birth date, so that it arrives just when people need it for decision making. Each of our texts has a link in it to some online source of information. And often this is videos, but it can be pictures or it can be a website. The idea of texting means that you can help people change behavior. If they aren't going to change behavior, they're not going to improve their pregnancy outcomes. But we model this in very affirming ways. We make people feel that they can make these changes. So we model behavior that works, and we use really encouraging, strength-based language when we talk about this behavior change. And in terms of partnering, we developed our texting messages after we did focus groups around the province, and we did them twice with people of all different ages and cultural and ethnic backgrounds. And then we also partnered with health authorities who told us what their problems were that they were having delivering information. And so because of those partnerships, we were able to get technical support, we were able to get design support, and we were able to focus our content into what people really needed.
So the premise of doing audio stories with research projects for us was about an effort to bring the voices of the people with lived experience into the representation of the research, instead of it just being the academics, and as I mentioned before. And so part of that, how that worked, was just not just reaching out to the researchers themselves or the community partner who may have been involved, but asking them, within the terms of agreement for the research projects and with ensuring safe access was possible, seeing if there were people that they had worked with who would be willing to talk about their role in the project. So for example, working with a community partner about the experience of temporary foreign workers during the time of COVID. And there was a community partner, Migrant Workers Center, with whom we had established relationships, and their members were people that had lived experience of being a temporary foreign worker during COVID. And so instead of talking about the research findings themselves, their stories are the research findings in some sense. And so that's one way of ensuring that diverse voices are represented, is by going directly to them and letting them speak in their own words, but also recognizing that just by creating a space for someone to share, that doesn't mean that they're going to be heard or heard well. Like, that's where the context of storytelling and how you construct a narrative and how you situate it with respect to the other parts of the narrative can really impact how someone's experience is received. So it's not just being thrown into a void, but it's being situated as well as possible. And hopefully that preserves an authentic representation for them. We discuss questions with them beforehand. In terms of consent, we make it clear that they can withdraw their consent at any point. They review the story in process and then get to do a final listen as well before anything goes to public. And so that gives them as much power as anyone has, and them the power, most importantly, to be involved in how their story is represented.
So we took some of our cues for storytelling from the people that we're working with that are going to receive those texts. So when we did focus groups around the province, people said to us, don't tell us about things that we don't need. We don't want to hear about smoking if we don't smoke. And so we developed a number of opt-in streams that people can use depending on their needs. So we have a stream for people who have lost a pregnancy. We have a stream for people who are new immigrants. We have streams for people using alcohol or wanting to cut down tobacco intake. We have streams for people experiencing violence in the home. And one of the things that these streams offer are privacy. And so if someone needs help and they're in a small community and they don't want to ask local people, they can find out through our message links where they can get help in the next town or through a provincial helpline or something like that. And that really supports the diversity of people being able to use the program. We are looking at translating it. That will be one of the things forthcoming. And we also work with a very broad advisory committee, including the First Nations Health Authority, who has gone over all of our wording, taken care to review how we use words that describe Indigenous health. We have our web pages from a number of different sources, including First Nations Health Authority. We have people representing neurodiverse groups on our advisory committee and all regions of the province, and people who live in rural and remote areas are particularly important to us because it's hard for them to get good information about pregnancy. So those are some of the ways that we really try to offer information in diverse ways and make it accessible to people in diverse situations.
So ensuring that the storytelling that we're pursuing is done ethically and in a good way in partnership. I begin all of these relationships with a conversation about how my partner would like to see me in a leadership role or not when it comes to this particular project, because each project has had different needs. So right now I'm working with a pediatrician in Vancouver when we're telling stories about the experience of neurodiverse children in the BC healthcare system. I have another project that's working with the Homolko First Nation on telling stories of that come from the traditional knowledge of the peoples of the Homolko First Nation. And then the third project that I'm working on is in partnership with several members of the community around immigration detention. And each of these partnerships have different requirements when it comes to the privacy, the anonymity of the individuals involved, and also where I should be in relationship to the project. So with the pediatrician that I'm working with, who wanted to tell the results of her particular study via comics and have cartoonists engage with this work, I took on a very hands-on role because of the need to have somebody as a project lead. But in the project with the Homolko First Nation, as a settler myself, it was essential that I became a facilitator and an individual with expertise on comics and the role that comics can play in telling in storytelling traditions, but also not the individual guiding that project. And so that partnership emerged with me just sort of consulting and being part of the meetings and connecting Chattis Leo, who is the lead of that particular project, with the individuals that he needed to connect with in order to succeed. And then the third project I'm currently working on requires that there's a lot of anonymity and very little reference to what's going on with regards to that project due to the individuals involved. So at the very foundation of the work that I'm trying to do using comics to tell the stories of individuals and scholars is consultation and ensuring that the individuals involved feel like they are dictating exactly what role I play, because I'm not drawing and I'm not also providing the stories. I'm just there as an individual that's facilitating these stories reaching a different audience through a different medium.
I think you touched on two things that are really important to, like, this whole idea of the consultation process is similar to what I was talking about, but how that relates to both one's role in the research and also to this issue of anonymity, which is something that was also important in our projects as well, dealing with precarious migrants for whom they could be vulnerable to employers or to other people if revealed. And I think that's one of the really interesting things about what storytelling approaches can do, is it can hold the space of something that's true but isn't fully revealed, like so that someone's identity can be protected, but what they're experiencing can be shared in just as compelling of a way, if not more compelling perhaps, than more traditional kinds of representation of that.
Yeah, that's one of the reasons why I really promote comics in exactly these discourses, is because of the way in which these stories about these complicated experiences are embodied. They're individual. They're represented in a way that we understand that when I talk about comics on refugee experience, we understand that there are millions of people on the move right now, but the story is situated in the narrative of one individual that is never easily identifiable unless they want to be. And so there is no risk to their asylum-seeking process, which could be jeopardized by there being any evidence of them landing in places before the country in which they seek asylum. And so the story can be shared. The problems, the difficulties that these individuals encounter can be shared to a wider public, to an audience that wouldn't otherwise pick up a story, but it doesn't do the work of photojournalism. And in fact, it does very different work than photojournalism. And I think podcasts are the same, that it offers opportunities to nuance the kind of images that we see coming out in the news about migration. And this, I think, is also true when we talk about comics that are telling the stories of the Canadian First Nations, Inuit, the Indigenous people of Turtle Island. It is taking these stories and trying to honor the storytelling tradition by way of the comics medium. And when I'm collaborating on these projects, I'm also very mindful of who I'm pairing these cartoonists with, and who is being paired with which cartoonists. And so I draw from a network of Indigenous cartoonists, trying to bring people together and not only support the storytelling that comes from that partnership, but also our local Indigenous cartoonists. So being mindful of who can tell these stories, what role I play in telling these stories, and how we can ethically ensure that they're told in a good way.
Mm-hmm. And one thing I found with that too, with that consultative process, and maybe you both have as well, is that it is something that just doesn't, you don't just consult once and then keep on going, but in general, and especially with creative or non-traditional approaches, like the consultation is something that best be ongoing, and that you end up having plenty of intersections at which there's a chance to consult, or that, and this was a positionality thing for me, that there's plenty of privileged white North American researchers who come in and like want to share your story, and there's so much that's fraught about that, but to think about that as using whatever positionality I have, to help support how they might benefit, first and foremost, how they might benefit, or what they may or may not want to share, and in what way, to what end. And it's not a tick box exercise, but it's creatively and research ways, relational and ongoing.
There are so many ways that working in comics has changed me, changed my research, changed the understanding of my partners in what comics can do, and also I think, in fact, changed the perception of comics here on campus. So with regard to my partnerships in the community, usually they start with me just being somewhere talking about what comics can do in sharing story, and then I get approached. I have not approached anybody to partner in the production of comics. I have been approached time and time again with people just saying, I've always wanted to make a comic about this. I'm like, well, you know what? We can do that. Let me tell you how. And so I have these meetings with these people, and I just talk about what I see comics doing in communicating marginalized experience, and how the format lends itself well both to partnered storytelling, but also to expressing traumatic events, complex historical events through the medium itself, like through the juxtaposition of image and text, through the paneling, through the layout, through the composition. And I think I just get really excited about it, and then they're on board. And so that I've seen time and time again as an impact with my partners, who then are just really excited to continue to work in comics, and then actually bring other people to join me in this conversation, and then the partnerships grow and change. With regards to higher education, academia, UBC, I think that I've seen how popular media is becoming very well recognized for the work that it can do, not only in representing complex discourses, but also in engaging new publics. And the Center for Migration Studies did a fantastic workshop pairing migration scholars and local cartoonists to tell stories of migration and identity at the intersection of migration and identity. That was very powerful. It was powerful for me. I'm part of another project that is a SHORK partnership grant that is working on using comics as witness testimony to human rights atrocities. And it's a global project, and it's very well funded, which is really exciting. Then the Public Humanities Hub approached me and asked me to establish a comic studies cluster. And then very recently, I think largely due to the activity of the comic studies cluster, a few colleagues, myself included, were awarded one of these grants for catalyzing research clusters on popular media for social change. And that's really exciting because a large part of that is going to be continuing to work with comics. So it's really exciting to see how even the university is starting to recognize the value of popular media in sharing stories, and how sharing stories changes people's minds in a way that sharing peer-reviewed articles doesn't when you're talking about certain demographics. Yeah.
Mm-hmm. That's similar in some ways to how audio storytelling and podcasting has been perceived and received in the academy. It's also, first of all, just as a way of knowing, has begun to be more accepted, and not just as an accessory to other research or an embellishment of it, but as a research method in its own right, based on what it can do as a medium that I was describing before about its intimacy, or what kinds of knowing it accesses differently than a peer-reviewed article does. And besides that sort of impacting what counts as valid knowledge and from whom in university spaces, I love the way that audio storytelling, it's relatively portable. I mean, it's also a popular media now, and people are familiar with it. And so it's something that can be used. We've seen it used in advocacy work. An episode that we made about immigration detention in Canada related to an Allard Law and CMS affiliate scholars' research on immigration detention here. It drew from an Amnesty International and Human Rights Watch BC campaign, and was ultimately used for advocacy at government levels because of its portability, different than a paper would be. Likewise, we had a policy practitioner from the School of Public Policy who was on leave from their work in a government agency related to immigration, and they do work with gender and migration and disparities in gender, and I worked with them to create a podcast as part of their visitorship here, and they took back that back to their colleagues in the government agency as a way to demonstrate analog examples from other non-Canadian contexts to how Canada could be improving its approach to gender mainstreaming in its immigration policies and other things. And then just the way that I mentioned before, like the temporary foreign workers that we worked with in those stories, they got excited. They were able to share those stories with their friends and families, and the organizations that they work with have also been able to use those for fundraising purposes as well as educational purposes, and they can also be used in classrooms for education. So those are the kinds of things that we dream about when we're imagining doing podcast episodes or audio stories for research.
So, in the course of developing our program, we did a lot of storytelling, and we changed our approach based on a story that was told to us by a northern nurse. And she told us that women with a particular blood type in the north, Rh negative, were not getting the critical injection they needed in pregnancy to prevent their particular blood type from attacking the baby that they were carrying. And this is a life and death situation. And we learned that it wasn't because people weren't getting good care, it's because they didn't show up for care at all. So if you're having your second or third baby and it's winter and it's snowing and the roads are icy and you don't have very much gas money, why not wait till you're 6 or 7 months along? Everything's fine. And so we realized that if these people weren't getting to the doctor, we had to get the information to them about getting to the doctor. And so, first of all, we developed an offline app, which you don't need cell coverage or internet to use, just a one-time download. And the biggest feature of this is a timeline, so that people find out when they must be in the clinic to get critical tests and assessments in order to have a safe pregnancy. So we are offering that now to remote communities, and we hope to evaluate that and see a change in outcomes. But I think that mutual storytelling, when you're developing a product, brings out ideas and issues that otherwise you don't hear about. It doesn't come out in standard questionnaires or surveys. You have to sit down with the people that need help, that are providing frontline help, and listen to the stories. And that's where you find the critical need.
Something you said when we were preparing for this really stuck with me. When you were talking about how story connects with the work that you're doing, you said that when you're distributing this information and circulating it, it's essential that the people receiving the text messages see their story in the information that you're sharing. And I think that that's reflected in the streams that you have, and also the focus groups that you did that emphasize listening and hearing the story of the clients that you hope to support. But that idea that you can't connect with people unless they see themselves in the story that you're drafting or sharing, or I found that so profound, and I found it really captured how I think storytelling connects with publics. People see themselves in it, and that changes.
And I also think it's a critical feature of digital health that people must feel that the program is for them and that they can tailor it. And that's why we have those individual streams. And the other thing that we learned from people is that they want to talk to each other. So how do you make a texting program that allows people to talk to each other? Well, people that are on a program get messages telling them that they can sign up for a forum. So we've also introduced a forum where people talk to each other in real time. And so that's all about problem solving. So it's one thing to tell people, here's what you need. It's another thing for people to talk to each other about how they met that need, or where did they get what they needed to get the food they needed, or the vitamins they needed, or things like that. And so people, once they're given information, will come up with solutions with each other through storytelling.
Mm-hmm. Yeah.
I love how that just encapsulates how there were research objectives that you had and like goals related to health that you had going into this, but there was an expansion of capacity within the community that in a way was part of this ongoing, I'm going to make this be an analogy of like the same consultative process, like you in listening to the people that were involved and in trying to expand their capacity rather than just solve a particular problem or answer a question. It grew from there to meet the needs that they demonstrated or articulated for themselves. And that's so beautiful.
I love how through this conversation, what we're saying about storytelling is as much about story listening as it is about storytelling. And it's this, and the relationship that builds between, we've used the word relationship, relational, listening, storytelling, and all these things are connected as a holistic methodology around the kind of work that we're trying to do.
Yeah, absolutely. I think you said it perfectly. I love how you were just talking now about how the medium makes a difference in what can and can't be explained. Like you were talking about what body parts can and can't be shown in story, like had that related to comics and your own stuff?
Yes, and in some cultures, showing a woman's bare skin and her bare belly is offensive. And then you think about, we talk about things like the health of the perineal floor and pushing the baby out, and what is that, what incisions are made during childbirth, and where are they, and how big are they, and what do they look like. Well, you're not going to photograph those, but you can do them with a cartoon. And that's very acceptable to people, and especially if they're animated, they can be fun. And even with people that aren't very literate, they're easy to understand. And with a few words, you can illustrate it better. And so we actually have cartoons on perineal health that are in our texting program, videos, and we're evaluating them.
Yeah, it's
People think.
I have colleagues that do medical illustration, and it's such an interesting field that no amount of technology is going to replace, because you need that subjectivity of attention when it comes to the representation of certain parts of the human anatomy, and while also being mindful of what you can physically take pictures of and what is appropriate to take pictures of. So I really like that.
I love how these different approaches, again, it goes back to this idea of what is accessibility here, like how can you get access to this knowledge about the perineum and such, like in a way that, well, how do you get access to it in a way that's acceptable
And not alienating,
Sure,
not the kind of material that you'd be confronted with.
Yeah, and that's the question that audio storytelling or listening, as you pointed out, or graphic narratives or other kinds of storytelling or creative approaches, that's part of what they do so well.
They communicate knowledge in ways that are accessible to different parts of us as embodied individuals. I always find it very profound, the information that comes across through sound that you're not aware of, like your comparison with the baby crying. And also through image, it for those individuals that are not as literate or are coming from a different context and don't speak the language of the majority or the language of the material that's being disseminated, the image has the burden of the communication, and then the text is just supplementary. And I think that's quite powerful in the way in which it's accessible to diversity of audiences that would otherwise maybe not engage in the material, maybe be ashamed that they're not able to engage in the material, maybe be pushed outside of that sphere or field of knowledge.
Yeah. And that's such a good reminder, especially for those of us in university contexts, that the supremacy, the so-called supremacy of reading and writing is really just a particular experience and a particular dominance in what is acceptable knowledge, what is acceptable communication, and all of the practices and traditions of other kinds of communication have existed since time immemorial in other ways and continue to go alongside that. And it's expanding the narrowness of that university field or the academic, what we call traditional field, to incorporate all those without the reading and writing being the only kind of literacy, but so many other kinds of literacy and communication that people have thrived in for forever.
Story in particular has historically here in this place for the indigenous people of Turtle Island been evidentiary proof of occurrences of things. And so we've lost contact with the value of storytelling in communicating knowledge. And it's something I'm grateful to have learned while working with Indigenous partners to see how I understand and carry story being validated and viewed differently in other communities. And then I get the opportunity to really lean into storytelling as a form of scholarship. So I'm so grateful to have been able to do that learning, which also came in partnership.
One of the things that I've learned is that you can't develop something, even if it's in your field, and then market it around to people and convince them that they should use it and pay for it. You must develop it with them from the ground up. And so we were asked to develop this texting program by Northern Health Authority to reach their people in rural and remote settings. And we then went to the Ministry of Health. They had done a gap analysis and discovered that mobile health was something that they hadn't developed, that they were behind the times. Could we do this with them? And in fact, they didn't ever give us any money, but they gave us their design team and their color palette and their tech people and their communication systems and all of these things that money couldn't even pay for in order for us to get our story out there about what we were doing and help all the frontline workers, the public health nurses, the family doctors understand what it was all about and promote it with their patients. So really, you need to work in partnership from the ground up to develop a common need that everybody understands and agrees with.
When partnered research is at its best, I think it changes you. That's kind of what I've come to see. That every time that I'm working in partnership, not only does my research change and evolve and become better and more impactful, I think I kind of change and evolve. And that's something that I think a lot of the siloed learning and research that happens in higher education misses out on. The opportunity to change and to grow and learn from people that have otherwise been pushed out of university settings as not having knowledge to share and help shape the discourses that we find ourselves in. So that's the biggest thing that I've learned from working in partnership is how much it changes me and how much I grow and how much I learn to value that growth, even when it's difficult.
I love how you put that. And alongside that, I hadn't thought in terms of how it changes me or us, but I will say in my growing experience with partnered research, I always find it pushes me into a deeper humility than I came into it with. And you think after each experience that, oh, I've learned another lesson about whose priorities should be articulated and how they pace a project or how it's imagined. But every time, despite my good intentions or even good practices, there's still another way that I realize that I've been either inserting myself or making a priority of certain kind of university assumptions or time frames or things like that, where relationality is really what's meant to be the bedrock of the partnership. And that's not bound by the same kind of time frames that grant deadlines and project deadlines that we make up have. And so a certain kind of reflexivity and patience and humility is something that I continue to learn and encounter the need for as we pursue more partnered research projects, whether in storytelling approaches or in others. It's always a slowing down and a paying attention and seeing how we can adapt the resources that we have and whatever desire to help build capacity that we have to the actual desires of the partner that we're working with.